The University of Iowa, it's a large academic center, and we really have lots of subspecialists in every field, and that does not exclude emergency medicine. When I was applying and sitting down for an interview, I was just hearing about different opportunities that we had here, different subspecialists. It kind of shows the types of opportunities that a place like this could have to offer.
Our program is very supportive in future careers. We try to identify that early on through mentorship in our residency program. So if a resident has an interest in a fellowship, we provide great mentorship in so many different areas of fellowship, from ultrasound, critical care, toxicology, sports medicine, pediatrics. I think that's because of the very strong faculty that we have here. Most residents choose to go into community practice, and we have an excellent community rotation at St. Luke's Hospital. So we have a great network in Iowa, and then in the Midwest we have about 80% of our graduates.
The collaborations that are available at the University of Iowa are incredible. We have collaborators in engineering, collaborators in public health, and really throughout the College of Medicine.
One of the reasons why we are so successful is also the breadth of the material that we cover. So whether we're talking about emergency psychiatric care, or sepsis, or trauma, or injury and violence, mental health, all of these different reasons, we cover so much breadth, and a lot of our team members have their own areas and their skill set that they bring so that we can make a project or a research question very successful.
Personally, I'm interested in sports medicine. We have the privilege of having a few sports medicine, emergency medicine trained physicians, and that really opens up a lot of doors. The program here has a history of training providers that often go into sports medicine. So for me, that was a kind of a no-brainer. And already within my first year of emergency medicine, I've had the opportunity to work in the sports medicine clinic and be involved in different events locally. So that was particularly useful to me.
Yeah, so our faculty here are amazing. So we have a great blend of faculty. So we have experienced faculty that have been doing this for a while. We have newer faculty that are starting their academic careers. But what unifies all of us is that we are committed and enjoy teaching our residents and our medical students and other learners that we have in the department. And we have faculty that are trained in the entire array of the subspecialty areas of emergency medicine, ranging from critical care to pediatric emergency medicine to hospice and palliative medicine to EMS, toxicology, just to name a few of the subspecialists that we have on our faculty. And so residents that come to our program not only learn core emergency medicine, but they have the opportunity to learn the various subspecialty aspects of emergency medicine that we have available to us in our department that flow through our faculty.
You can choose any pathway that is better for you. If you want tox, if you want sport medicine, there's many attendants here that will help you with that pathway. They have so many, a broad spectrum of attending inside the emergency department that you feel that you cover all the bases.
I personally had a very hard time figuring out what I wanted to do with my life, which specialty I wanted to do. And so when I was going through as a third and fourth year medical student, I wanted to try everything. And what I found at the end of that was that I loved everything, which is why emergency medicine was a great pick for me. And I think that holds true for a lot of medical students. Emergency medicine is the perfect melting pot. I wanted my coworkers to be my family. I wanted work-life balance, and I wanted a supportive environment for my career goals. And emergency medicine fit all of those things, and I get to have a ton of fun every day. And so I think those are the most important things to me.
I'm excited to work at a place like Iowa. For me, that means training in an area that has lots of subspecialists that can further my education, and then going out to practice in a community setting where I'm able to use those skills and take them back to the community that I want to end up working in the long term.